Hello, my name is Zephyrin Valentin, and I will be doing my IM injection video. After carefully reviewing my patient's orders, I have to administer hydroxyzine or Vistaril, 40 milligrams IM, and I have the medication here, and the medication bottle is labeled 50 milligrams per ml. And after my calculations, I have come up with 0.8 mLs to be injected into the ventral gluteal or vastus lateralis, because this medication strictly says in the drug book not to give in the deltoid site. And we will be trying to use the Z-Track technique. It's recommended for this medication. So I have my medication at hand. I'm going to go ahead and draw it up. Actually, I'm going to go ahead and meet my patient real quick. Alright, knock knock.
Come in.
How you doing, sir?
I'm okay, how are you?
I'm okay. I'm just going to wash my hands real quick here. Sir, I am here to give you some medication that the doctor has ordered. But in order to do so, I need to verify first your name.
John Smith,
Okay, date of birth.
2/14/1960.
Okay. So I'm going to be administering some medication. I'm going to go ahead and raise your bed for proper body mechanics. The doctor has ordered 40 milligrams of Vistaril.
Oh, what's that?
Well, this medication is a anti-anxiety medication, and it's also used to help sedate you for your pre-op. Okay, for this site that we're going to be using, we're going to use the vastus lateralis. We're going to need a needle in the range of 20 to 25 and 1.5 inches long. And I have a 22 gauge here, which is 1.5 inches long, and I can get the proper amount that I need. I'm going to start off by wiping my med bottle. And we're going to need 0.8, so we will draw 0.8 of air. of air.
Okay.
Okay. We have 0.8 mLs of Vistaril. Okay, and that would give us the dose that we need. Okay, the alcohol swab. For this medication, sir, we're going to have to use a Z-Track technique. I'm going to go ahead and uncover your leg so that we can give you your injection. And I'm only going to dispose what we need to dispose. Have my medication right here. It's within sight. Put on my gloves. Okay. Alright, So we're going to go ahead and go under the trochanter and divide into thirds, above the knee and divide into thirds. And you see that area right there, just above my thumbs, would be where we would be giving the injection. Okay? We're going to get ready to give the injection. So first I'm going to wipe, starting around the selected area and working my way out. Okay, this medication, we're going to use a Z-track technique where we would grab the skin, push back, and then we would go straight in a 90-degree angle, and we would aspirate really quick. No blood return, so we know we're not in the vein. We would push, remove the needle, and let go of the skin. And that is how you would give your IM injection and the vastus lateralis with the Z-track technique. Yes, we would have to remember always when giving these medications that we have to check our 6 rights, which is the right patient, the right drug, the right dose, the right time, the right documentation. And those are the rights that we need to check, and we would cover our patient up. All this stuff can go in the sharps container, except for the alcohol swabs. We will cover our patient up. Sir, is there anything else I can do? We would make sure the call light is within reach, which it is. We'll lower the bed back down for safety. Be sure that the bed is locked and in position, side rails up. And if the patient doesn't need anything, then we can go ahead and wash my hands, prevent infection control, and I would advise the patient that he's probably going to feel a little bit dizzy. You know, it's a sedating medication, so if he needed anything, please call for assistance. Do not attempt to get out of bed by yourself. This medication has those kind of side effects, and I would make sure I take my orders with me, and I would go ahead and get ready to do proper documentation, and that's about it for this technique.